On this therapy, we have hyperbaric oxygen, we have ozone therapy, we have hydrogen peroxide as well. All those mechanisms we use to oxygenate tissues while at the clinic. And then we send patients home with information on how to continue those therapies while they're at home. So oxygen therapy is absolutely paramount. Now there's another thing that's out called Beamer technology, B-E-M-E-R. And we have the Beamer mat here, okay? The Beamer mat, they say, oxygenates tissues 30% more than a hyperbaric chamber. Why? They say that, and this is true, you can prove this on a live microscopy. If I take a pinprick of your blood right now and put it on a live microscopy, our blood cells are all clumped together from improper diet, from stress, but particularly from EMF radiation. It's all clumped together. So when the blood cells are clumped together, the surface areas of the cell membranes, they're not maximized. They're inefficient. So you can't detoxify properly, you can't oxygenate tissues properly, you can't assimilate nutrients properly, none of that can take place. When you put somebody on a Beamer, all of a sudden, all those blood cells, they disperse completely. And now you have perfect spherical blood cells with the entire cell membrane exposed that you can now get oxygen into, that you can detoxify properly, you can get nutrients in properly. So the Beamer is probably one of the greatest things that we've added to the therapy since Dr. Gerson's death. Everything we do on the Gerson therapy requires that those cell membranes be completely exposed for the utilization of oxygen, nutrients, and detoxification. So we do oxygen therapy. The other thing we do is we do hyperthermia. We do hyperthermia by immersion hyperthermia. So we immerse them into water that's about 110, 112 degrees. We know that cancer cannot survive above 106 degrees, 106, 107 degrees. So if you can immerse the body and raise that temperature to 106, 107 degrees, then you can start to kill off cancer cells, as well as viruses and bacteria. We know they can't survive in that either. So the high doses of vitamin C, we know that worked from Nobel Prize winner Linus Pauling. He won his Nobel Prize based on the work on vitamin C and the boosting up of the immune system. Ultimately, you can take the Laetro, you can take the hyperthermia, you can take the oxygen therapies. These things in and of themselves, they're not going to permanently reverse cancer. They play an adjunctive role in permanently reversing advanced cancer. Ultimately, it's the diet and the detoxification that boosts the immune system, and it's the immune system that ultimately destroys cancer permanently. So we use these things as adjuncts. We're using Laetro. All right, our patients are getting 9 grams, which is the ultimate therapeutic dose IV of Laetro, 5 days a week. They're getting IV vitamin C anywhere from 25 to 50 grams daily for 5 days, okay? Based on whether or not they can handle that. Some people can't handle it daily at those quantities. They're getting IV chelation as well. So those things are, again, used as adjuncts. And now we're embarking on infrared technology. If you read the science that's coming out on infrared technology, using infrared with chlorophyll, where are they getting their chlorophyll? From the diet. Our patients are getting 4 green juices a day. They're getting salads every day, twice a day at their lunch and dinner. So when you mix infrared and chlorophyll, that's killing cancer, they say, better than chemotherapy. So we're also utilizing infrared technology as well. I can't imagine there's any clinic out there that has a more comprehensive protocol integrating these adjunctive therapies with what has been time-tested and proven to be the most storied therapy in the history of alternative medicine and reversing advanced disease in the Gerson therapy. Those two things combined, I can't imagine there's a more comprehensive protocol.